Today, we'll discuss a real case. A 51-year-old man with a 2-week history of productive cough, shortness of breath, and back pain. He smokes 30 cigarettes a day, and he's worried this might be pneumonia. So what's really happening here? Let's walk through the clinical reasoning step by step, just like in a real consultation. The patient says the cough started 2 weeks ago. It's productive yellow-green sputum with an unpleasant smell. He denies fever, but says he wakes up at night coughing and gets short of breath with exertion. These are common symptoms of lower respiratory tract infection, but we need to decide, is this viral or bacterial? Or could it be early pneumonia? On examination, temperature is normal, pulse 90, respiratory rate 12 per minute. Chest sounds are clear, no wheeze, no crackles, no signs of respiratory distress or systemic illness. If you're thinking pneumonia, stop here. A normal respiratory exam and normal vitals make pneumonia very unlikely. So we're left with viral or bacterial LRTI. In primary care, most lower respiratory infections are viral and self-limiting. Bacterial infections are less common but more likely in smokers with thick, colored sputum. So this man's sputum and smoking history make bacterial infection possible, but not certain enough to jump straight to antibiotics. The patient insists, "Doctor, I had the same thing last year. Antibiotics made me better." That's a classic moment in primary care when clinical reasoning meets patient expectation. So instead of saying yes or no, we can use the delayed prescription strategy.
Here's a prescription, but only use it if you feel worse after 3 days or develop fever, chest pain, or blood in the sputum.
This approach maintains trust while reducing unnecessary antibiotic use. Studies show delayed prescribing significantly lowers antibiotic consumption. Smoking is one of the strongest risk factors for recurrent respiratory infections. It damages ciliary clearance and increases mucus production. So, even though the infection may pass, the real long-term treatment here is smoking cessation. The doctor gives a smoking cessation leaflet, but the patient isn't ready to quit yet. Let's summarize what we learned from this case. Always start with a thorough history and physical exam. Not all colored sputum means bacterial infection. Delayed prescription is an effective balance between caution and education. Every encounter is a chance to discuss smoking cessation. Overuse of antibiotics increases community resistance. If you enjoyed this case, make sure to subscribe for more case-based discussions. Next week, we'll analyze a patient with fever, dysuria, and back pain. What's your diagnosis? Comment below.